Everyone, how are we all?
Morning.
It's a lovely sunny day. Okay, let us know when you're good to go. Wonderful. It's wonderful to be here at the site of the Kallangur Satellite Hospital, one of 7 satellite hospitals we're building across southeast Queensland to help with some of those pressures we are seeing in our emergency departments and in our hospitals, and importantly, bringing health services closer to communities. I'm here with Nikki Boyd, member for Pine Rivers, and Chris Whiting, member for Bancroft, whose communities will certainly benefit from this satellite hospital. And today we will be doing a sod turning on this site to see construction get underway, and these facilities will be up and operational in the next 12 to 18 months, which will see real pressure, we hope, being taken off some of those EDs. But importantly, what we're going to see is things like minor injury and illnesses clinics, so people won't need to turn up to our big hospitals to get that sort of care. We'll see things like renal dialysis and chemotherapy. We've seen mental health going into some of these hospitals, some of our outpatient services being relocated as well. And what that does is also not just take some pressure off our EDs, but also, of course, it creates extra room in our hospitals to expand our bed capacity. Now, we know this is only one of many initiatives that we have announced to help with the increasing pressure we are seeing on our hospital system. We have, of course, our record operational budget of $23.6 billion, and we also have the largest capital investment that a government has ever made, $9.785 billion to create 3 new hospitals, 11 expansion hospitals in major areas, and of course new facilities and redeveloped facilities in many of our regional and remote communities as well. So the biggest capital investment and build that this state has seen in decades. Now, of course, capital infrastructure is great, but what's important is building the workforce, and we have committed to 9,475 extra frontline staff in this term of government alone. And we will be holding a health workforce summit with key stakeholders next week on the 27th to help build on how we can grow our own workforce, how we can attract people into the health workforce and we can retain people in the workforce. And of course we continue to work with the Commonwealth on key issues like aged care, disability, and those failings in the primary care sector where less people are getting access to GPs, less affordable GPs, and of course the decline, the largest decline we've seen as far as private health in this state, which means more and more people relying on the public health system. I want to briefly touch on the reports that we're seeing in today's paper around the significant incidents and the deaths. Of course, every single death is deeply sad, and our condolences go out to those families. Of those 20 deaths that are reported in today's paper, 18 relate to QAS and 2 are reported as individuals who passed away at a later time in hospital. These are incidents where they have been reviewed as part of the significant incident review process. This happens on a regular occasion so that QAS can look at the circumstances and the learnings that can be gained right from that first call to 000 to the response that is given on the ground. Often the QAS respond proactively to refer those matters to the coroner, and also they reach out to the families. So I do say that the reports today that this information is somehow secret, that this is new information only released today. I spoke about this in Parliament weeks ago. It's been reported by Channel 7 3 weeks ago. The Assistant Commissioner of the Queensland Ambulance Service, who's joining me here today, has made himself available on numerous occasions to talk to the media about these incidents. And of these 20 incidents, and where we say we've been talking about the 18 that come from QAS, that's in relation to 1.8 million QAS responses over that period of time. 1.8 million responses from the Queensland Ambulance Service at that time. And many of those significant reviews, and the Assistant Commissioner was just talking to me about one of them, where recently there was a stabbing that led to a death in the city, in the valley. That in itself is deemed to be a significant incident, and they review how they responded to that. So reports that these deaths are directly linked to delays from ambulances arriving or delays awaiting admission into hospital are not correct. The fact is there is no findings in relation to these matters and these deaths where the delay has been directly linked to the cause of death. And I think that's really important in the reporting that the media does on these. It is important that the factual information is put to the public so they know that there has been no findings that those delays led to these deaths and were the cause of these deaths. But of course, every death is sad and tragic, and as I say, our hearts go out and our condolences to those families. It's also the pressures on our health system why we are putting in record investment. Since the Palaszczuk government came in 2015, we have continued to build, to invest, to increase our workforce and increase our bed capacity. But we are seeing and facing extraordinary times. I'm very pleased with our latest figures where we have managed to get COVID, the impact of COVID down to now less than 150 hospital beds in our public system. And of course, we only have just over 200 staff across the whole of the health system, the public health system, furloughed because of COVID. At our peak, we had over 400 QAS staff alone, let alone the thousands of those across the hospital and health services that were furloughed and not able to go to work. That, along with the suspension of planned care and the hundreds of beds taken offline to manage COVID patients and not available for emergencies or planned care, all put additional pressure on the system, a pressure that has been building for many years due to many of the issues that I've just talked about today. I just will hand over to Nikki Boyd and Chris Whiting, see if they want to say a few words, and happy to take questions on the satellite hospital first and then any questions on other issues, and I do have the Assistant Commissioner here if there are any questions for QAS as well. Thanks. Nikki?
Thank you. Thank you, Minister. It's wonderful to be here today in Kallangur to officially turn the sod on the Kallangur Satellite Hospital. This is a really important piece of infrastructure for our local community, and it'll mean that rather than travelling to the Prince Charles Hospital or to the Royal or over to the Redcliffe Hospital, my community will be able to access local health services here close to home. It'll be a real game changer, particularly for people who are undergoing ongoing treatment and are unwell while they're undergoing that treatment. So can I thank the Minister again for this wonderful investment. It's such an exciting milestone to be here today to share in this big investment for local health services. It's something that we absolutely welcome, and it's something that we're absolutely going to take a lot of use of once it's finally completed.
Thank you, Nikki. It is so wonderful to see the ongoing investment happening in our communities. The Redcliffe Hospital, the Caboolture Hospital, and now here. This Labor government, this Palaszczuk government is investing so heavily and producing so many great results in health for all our constituents, and people realise this. They see what's going on, they visit our hospitals, and they can see exactly what we're doing and how good the future is going to be for them and their children. Thank you.
Questions on the satellite hospital?
Is the program still running over budget and behind schedule for the satellite hospital?
So as I said, our estimates earlier this year that there has been some delays. Those delays have been caused by a number of reasons. The supply chain issues that we're all well aware of, the entire construction industry has faced those supply chain issues. Also with the wet weather we had earlier this year, that led to a number of sites having to shut down and being delayed. And then we've had some other issues, which includes this site here on our Bybee Island site, where we've been working with with the local elders on native title issues as well. So I'm really pleased that we've been able to work through those issues, and we're here today ready to turn the sod.
So the election promise was for them to open by 2023, I understand. Are you confident all of the satellite hospitals will be open next year?
Look, we are working as hard as we can. I want to acknowledge Hutchinson's Builder as well. We know that it's been a really good model to have a single provider doing all 7 satellite hospitals. We certainly want to see these completed by the end of 2023. And that's what we're aiming for as best as we can. I know we've announced that there's going to be more rain over Christmas again. It's going to be another wet summer season, so none of us can predict what that might lead to. But I know everything possible is being done to deliver these satellite hospitals as quickly as possible.
But given those factors that you touched on, is there a chance you're not going to be able to deliver on that promise?
Oh, look, it would be, irresponsible of me to say that I can stand here and guarantee that every single one of them will be open by the end of 2023, considering all of those factors. But we are certainly still working towards those timeframes. And as I say, there's been a couple that have been delayed a little bit longer, so that may mean a little bit of slippage. But I'm still confident, that we're going to have these operational very quickly.
Considering the shortage of health workers as it stands right now, how will you staff these satellite hospitals?
Well, that is a challenge. Obviously we've made the announcement around nurse graduates and increasing our nurse graduates over the next 2 years. We have this summit coming up on the 27th. We are doing everything we can to recruit new workforce and of course retain existing workforce. It has helped that we are seeing a lot less furloughed staff. And I know that the hospital and health services, are doing their best to recruit across the whole health spectrum. There are shortages across this country, and we are working with the Commonwealth right now about some of those initiatives, which includes those coming from overseas and being able to work from overseas and trying to streamline those processes. As has been reported, the Palaszczuk government has put up some initiatives around retired nurses being able to come back and not have their pension impacted on, so that they can mentor those graduates, because there's plenty of graduates out there, but we need the experienced staff to help mentor them through. And so we're looking at a whole range of initiatives of how we can bring more staff online as quickly as possible.
Doesn't that assume that a retired nurse is willing to come back? Even though the reason they retired or retired early might be because they are completely burnt out by the state of the health system as it stands.
Look, these are nurses who may have retired in the last couple of years, may have been a bit longer than that. I meet retired nurses all the time who are willing to come back. In fact, the Nurses and Midwives Union Midwifery Union has said to me they've got over 2,000 retired members who have indicated they're willing to come back, but don't want their pension impacted. So we know there are ones out there who want to retire. I've actually presented awards to nurses who are retiring who have said to me, as soon as I retire, I'm going to offer to come back part-time and do some work. So they are out there. They don't all want to work full-time, but that's fine. We want to find that flexibility for them to be able to come back, and even if that's part-time, so that they can help us mentor through. But they're out there, we know.
It is a challenge though, isn't it? Because the unions also pointed out that people are just quitting or they're retiring early because they are exhausted.
They're absolutely exhausted. I don't think any of us can truly understand the pressure that our health workers have been in and under. Unless you've done that job, unless you had to front up every day and put on all of that PPE and the heat and exhaustion you feel from just wearing that for many, many hours every day, understanding that just to go have a drink of water, you have to take all of that off, have a drink and put that all back on again. The public are not aware of the sacrifices that our health workers have made. One of our paramedics that I met in Thursday Island just the other day, who was working down here in Brisbane for one of our big hospitals, who every single day watched someone die from COVID and got burnt out and asked for support and was able to get transferred to Thursday Island to get that break from that pressure, and has now gone and joined the Queensland Ambulance Service as a paramedic, who was originally a paramedic before she went to nursing. We need to listen to these staff who are exhausted, who are fatigued, who need a break, and provide them that break. We need to have the staff to be able to backfill them so they feel confident that they can have these breaks. But it is not an easy solution. There is a global shortage. The National Health Service in the UK is looking for over 96,000 health workers right now because of COVID. There are thousands of health workers who lost their lives during COVID because they cared for others and put their lives at risk. And there's many, many others who have walked away from the profession all across the globe. So there is an incredible pressure on the system. There is no quick fix, but we are eager to find solutions, and that's why we're having this summit. That's why we're engaging with stakeholders. That's why we're engaging with the Commonwealth and every health minister across every state and territory in this country, because every single one of us are facing the same problems, and we're all keen to find solutions.
Do you accept that the health system in Queensland is in crisis?
I have said time and time again, our system is under incredible pressure. But we also must acknowledge this. We didn't set up temporary hospitals in convention centres or parks. We didn't dig mass graves. We did not lose tens of thousands of lives because of COVID. We have managed this. And yes, in managing it, it means that there has been longer waits for ambulances. It means there has been longer waits in emergency departments. It has meant that there has been delays in planned care. All of those things had to happen so that we had enough beds in ICU to look after those most at risk and most sick. We've had those beds. We've been looking after Queenslanders every day through this pandemic. And as much as the pressures are extreme and the most intense pressure we have ever seen on the health system here in Queensland and across this country, we have done remarkably well, and we should acknowledge that each and every day. When we talk about these significant incidences and we talk about these deaths, we also need to talk about the 1.8 million presentations that QAS managed over that same period of time.
The AMAQ, the Australian College of Emergency Medicine, and the Australian College of Nurses are all in agreement that these pressures on hospitals have existed before COVID, and COVID was a catalyst, not a cause. And that it has been a lack of forward planning for population growth for years, if not decades, that has caused this. Do you accept that?
Well, if anyone's listened to any speech I've ever made when it comes to the pressures on the health system, they would have heard, as I said again today, that these pressures have been exacerbated by COVID. But what we have seen, not just with population growth and ageing population, we have seen an increase of beds being taken up in our public hospital system by people who should be in aged care or getting support through aged care in their homes that don't need medical care. We have seen an increase in people with disabilities who are not needing medical care in hospital beds. We have seen a reduction in people taking up private health insurance. And when they do have private health insurance, we're seeing more of those people coming into the public health system because they can't access or they can't afford the private health and it's not necessarily available in their regions. We know more and more people are not able to get in to see a GP quickly. They're either not available in their area when they need to see them, or they're not affordable. All of those issues, every single one of those issues have caused pressure and have built up over many, many years. And I know the LNP, I'm sure, will stand up today and carry on about their 4-point plan, which is just rhetoric. There's no jobs and there's no dollars attached to any of that. But the LNP, if they want to talk about the pressure on the health system, must acknowledge their contribution to that pressure. When you cut 1,400 health workers out of the system and you fail to build anything over 3 years, then you don't have the right to stand here now and say, why haven't you done something earlier, when they contributed in part to those pressures?
In terms of those 20 deaths that you mentioned, But ambulance delays, while they may not have been a direct link, was certainly a factor, right? And there were those common themes of pressure on the system, less favourable working conditions for people, though. So, I mean, that's alarming, though, isn't it? That you obviously like the demand is huge, it's growing, but in those circumstances, you know, a lot of those cases
I've said on numerous occasions, I mean, I don't want anyone waiting, you know, beyond what we set ourselves targets and benchmarks to respond to people. And it's true that, you know, our highest category get responded within those targets we set ourselves. But we need to be doing more, and we are doing more. You know, anyone who is looking at the pressures on the system also need to be looking at what we are doing to invest and try to address these pressures. I don't want people waiting long periods of time either for an ambulance or, you know, waiting to get admitted into EDs or into hospital beds. That's why we are building 2,509 extra beds. That's why we're bringing extra beds online. That's why we have already started building the Kallangur expansion and the Logan, and we have invested and we are expanding or refurbishing just about every major hospital in this state since we came into government in 2015. So our record you know, shows that we have continued to invest time and time again, and that this budget actually acknowledges all those pressures that we're talking about. That we do want to make sure that people are getting ambulances as quickly as possible. There will always be times that people will have to wait. There will always be times that ambulances get diverted because a more urgent case comes and they need to respond. These are decisions that are made by experts at the time that it occurs, and I'm not going to be critical for those decisions. But of course we want to see the waiting times brought down. But that is going to take some time, and it's going to take effort across the whole of the health sector and external stakeholders as well, and all levels of government to help make that happen.
You can't deny them that those waiting times were an implication.
Well, you cannot say, though, that they are a cause of the death. And I think that's really important. I think it's, well, I guess you can define what factor means. Yeah, if you say it was a factor, then the public read that as this contributed to that person's death. It caused their death. And it is not fair to do that. It's not fair to do that to the Queensland Ambulance Service. It's not fair to do that to those in the operational centres and in our coordination hubs and those paramedics who respond to these individuals. I've met the significant incident teams who sit there and review all of these calls and the outcomes and look at the learnings to be gained from it. But to use words in such a way that the public read this as this caused their death is unfair to our health workers who work tirelessly every day. If it does cause a death, then we'll absolutely acknowledge that. We proactively refer these matters to the coroner. We notify the families. There's nothing secret here. There's nothing secret about it. This is the normal process that QAS go to, but it is very unfair to the health workers to report that these delays led to these people's deaths.
It was revealed in estimates.
Very last one,
it was
thank you.
revealed in estimates that there were 9 matters referred to the coroner by the QAS. Will you be proactively releasing the findings of those to the public?
My understanding that the coroner releases those reports publicly anyway. So it's the coroner that does that, and then we have an obligation to respond to any recommendations from the coroner. I knew that as the Attorney General, same as when I'm the Health Minister. There is an obligation on every agency to respond to any recommendations that come out of coronial inquests and to say what they're doing as far as implementing those recommendations. So of course we don't need to release them because the coroner does that, but of course we release our public response to those recommendations and our ongoing implementation of those recommendations, as does every agency. Thank you.